2010. Okay. Ma'am, I'm your nurse for today, and my name is Charlene. Then, ma'am, I'm going to assess your head and neck, ma'am. Next, perform hand hygiene. Next, wear gloves or clean gloves if necessary. Inspect the head and then the face for color, symmetry, lesions, and distribution of facial hair. Note facial expression. Palpate the scalp. Inspect the external eye structures, cornea, conjunctiva, and sclera. Note color, edema, symmetry, and alignment. Examine the pupils for quality of size, shape, reaction to light by darkening the room and using a pen light to shine the light on each. Test for pupillary accommodation and convergence as the patient to focus on an object as you bring it closer to the nose. Using an ophthalmoscope, check the red reflex. LEPODPCT FDPLTCEO. With the patient 2 feet away, ask the patient to focus on your finger and move the patient's eyes through the 6 cardinal positions of gaze. Inspect the external ear bilaterally for shape, size, and lesions. Palpate the ear and mastoid process. Perform an otoscopic examination. For an adult, pull the auricle up and back. For a child, pull the auricle down and back. Note cerumen, edema, discharge, or foreign bodies and condition of the tympanic membrane. Use a whispered voice to test hearing. Stand about 1 to 2 feet away from patient, out of her line of vision. Ask the patient to cover the ear not being tested. Perform tests on each ear. Use a tuning fork to perform Weber's test and Rhine's test if the patient reports diminished hearing in either ear. Inspect and palpate the external nose. Palpate and lightly percuss over frontal and maxillary sinuses. Transliminate the sinuses if patient reports tenderness. Occlude one nostril externally with a finger while patient breathes through the ear. Repeat for the other side. Inspect the internal nostrils using an otoscope with a nasal speculum attachment. Sapa. Hindi, ulitin mo. Ulit. Next, perform hand hygiene. Wear gloves or clean gloves if necessary. Inspect lips, oral mucosa, hard and soft palates, gingivae, teeth, and salivary gland openings by asking the patient to open the mouth wide using a tongue blade and pen light. Inspect tongue. Ask patient to stick out the tongue. Place a tongue blade at the side of the tongue while patient pushes it to the left and right with tongue. Inspect the uvula by asking the patient to say ah. While sticking out tongue, palpate tongue for muscle tone and tenderness. Remove gloves. Palpate the forehead to the posterior triangle of neck for posterior cervical lymph nodes using finger pads in a slow circular motion. Inspect and palpate the left and the right carotid arteries. Only palpate one carotid artery at a time. Use bell of stethoscope to auscultate arteries. Inspect and palpate trachea. Palpate the thyroid gland. Then, if enlarged, auscultate thyroid gland using the bell of the stethoscope. Inspect and palpate supraclavicle area. Inspect the ability of patient to move her neck. Ask patient to touch her chin to chest and to each shoulder, each ear to corresponding shoulder, and then tip head back far as possible.